Welcome back, ladies and gentlemen. On 15th August 2020, Honorable Prime Minister Shri Narendra Modi announced the launch of the National Digital Health Mission as a part of his Independence Day address. Digital health solutions are powered by technologies such as artificial intelligence and machine learning. Adopting these with prevention, diagnosis, and cure can help India run closer to the goal of digital health for all. To discuss this in detail, we have a panel discussion on digitizing healthcare ecosystem for New India. I would now like to invite Mohammed Ujale, Senior Assistant Editor, ET Government, to moderate the discussion. Over to you.
Hello and very warm welcome to ET Government National Governance Virtual Summit. In this special panel discussion focused on digitizing healthcare ecosystem for New India, we are going to discuss and explore the impact of COVID-19 pandemic on healthcare delivery across the country and how the pandemic has accelerated the need for an integrated digital healthcare infrastructure, and will technology-led initiatives such as Digital Health Mission have a serious or long-term impact on healthcare infrastructure? And will it empower our secondary and tertiary healthcare center, which is more closer to the people in large parts of the country? To enlighten on this, I am joined by Dr. Praveen Gedam, Additional Chief Executive Officer, National Health Authority and Mission Director, National Digital Health Mission. Ms. Karuna Vakati, Commissioner, Department of Health, Medical and Family Welfare, Government of Telangana. Mr. G.S. Naveen Kumar, Special Secretary, Department of Health and Family Welfare Services, Government of Andhra Pradesh. Mr. Mohammed Safirulla, Project Director, State Digital Health Mission, Government of Kerala. Mr. Kumar Vineet, Special Secretary with IT and Electronics Department and Managing Director of UPDESCO and UPLC from Government of Uttar Pradesh. We are also joined by Dr. Akash Malik, Senior National Program Manager at UNDP India, and Ms. Swati Rangachari, Vice President and Country Leader, Public Affairs and Strategic Engagement at UnitedHealth Group. Thank you everybody for joining us for this special panel discussion today. Let me begin with Dr. Gedam. Dr. Gedam, what we have realized during the pandemic that whether you belong to any sector, there was some type of impact on every sector and every organization tried to mitigate the challenge. And for healthcare sector, it was completely a different game altogether. I mean, the kind of effort which were put by doctors, the entire healthcare ecosystem across the country was unmatchable. I would like to understand from you your general assessment of pandemic impact and the kind of change it is bringing in our thought process for healthcare across the country.
I think the COVID pandemic has been a kind of watershed moment, not only in healthcare, but in human history in general. And it's a topic in itself to be discussed at length. But since we are discussing digital healthcare today, I will focus on the impact it had on the digital healthcare. One, the acceptability of digital solutions increased, it shot up. Earlier, patients and doctors both, they were not very keen on or there was some, they were not very comfortable with the digital interaction, and physical meeting with doctors was always something which we were looking forward to. So that thing changed, and all of a sudden, so people are now very happy for teleconsultations. One thing. Second, and it picked up. So it didn't require a huge or long learning curve. Second thing which we noticed is a very fragmented, haphazard kind of interactions going on. People were using WhatsApp calls, Zoom calls, they were sending messages where can I get this drug or where can I get bed. So there was it was very clearly noticed that we need some kind of unified approach, a structured approach for the best utilization of our resources and most efficient management. So these are a couple of learnings which I think that we got from COVID pandemic. One of the result, and I can say that the digital health mission of India is largely an outcome of these two factors which we learned during the COVID pandemic.
Right. Before I go to Ms. Karuna Vakati, I'll go to Mr. GS Naveen Kumar. Mr. Kumar, if you could share based on your experience over the last 2.5 years, the kind of work that you have been doing in the far-flung area within Andhra Pradesh, what have been your general assessment of impact and how did you mitigate the challenge? And if you could also shed some light on the way actually some of technological platform helps you.
I think, as Sir has mentioned, it was the biggest watershed which we have seen in the past. But I would also call it technology resilient. I think the way we came back using technology, I think this also has put I think there's a lot of trust factor which has happened during this time on technology. In fact, if you see it, we always had that thought that technology is supposed to be bad or something. But I think this was one instance where government went on using technology in a big way. Okay, I remember when the first lockdown happened, everybody was cut down, and then suddenly you have to train 8,000 people in Andhra Pradesh for the grassroots workers. We had to use Zoom, so we had to do meetings in the morning in the second of everything, and we were able to train 8,000 people in a couple of days. Okay, so that's one thing which we were able to do. And the scale, the kind of scale which we achieved using technology, that's very important. And I think rightly said by Praveen sir, ABDM is, it's putting something which actually would benefit the citizens 10 years, 15 years from now. I don't see, imagine a kid who is born right now, all his digital record is available. And if he goes anywhere, all his digital record is going to be available whenever he goes to any place. So that's the kind of, in fact, I think one of the meetings which we had with sir was, he said, don't look at past data. Look at present. From present, we'll move from here. So I think that's the step forward. I think it's going to be a great, movement in terms of digital disruption. I don't know. I think people stop calling it disruption anymore. I think it's a revolution of its own kind in healthcare, and we start moving from here. I think that's probably. I think I quote this from the Praveen sir's comment. So that's
right. Absolutely, I completely agree with you. We are also joined by Dr. Akash Malik. Senior National Program Manager at UNDP India. Currently, he's representing the Additional Secretary's office. And we also have Ms. Karuna Vakati. Ma'am, I'll come to you before I go to other speaker. What have been your assessment of pandemic impact and some of the things that you did in Telangana, if you could share with your experience, ma'am?
I think that pandemic has challenged the public healthcare system like never before, as Praveen sir was just mentioning. So it has forced us to find ways, and that too digitally, to find solutions, because it was a battle for survival, so to say. Though I would say the solutions are coming after the pandemic, because we all now understand that the digital platform is where there's going to be more robust and resilient kind of a solutions which come out rather than the offline platforms. So the structured part of it, I think, will happen eventually. The whole digital health cards and how this is going to be read across the public healthcare facilities, etc. So, however, in the pandemic, I think one particular intervention stands out as far as I'm concerned, which was tremendously helpful for the pregnant women, is we do have a very robust teleconsultation platform where a medical officer is able to go online, book an appointment with a specialist on a given day. And we have monitors where the specialist appears and the patient and the medical officer are able to see each other. And there is a teleconsultation at the end of which there is an e-prescription given and the medicine is given. Now, in the pandemic, when the primary health centers became the COVID care centers, for some time or for a long time, we did not have the pregnant women have access to the specialist advice. except during the labor because the hospitals are all jam-packed. So what we did was for the Mandal supervisors, Mandal is 1/5 of a block in Telangana, we gave them tabs where they were able to actually connect to the gynec's and take appointments, and they were actually going to the women's houses and doing it, and that helped a lot. So in each mandal, the district of Medak where we piloted it reported more than 800 consultations in just a matter of 2 to 3 months. So we are actually taking technology healthcare to the doorstep of the people. So I think that kind of out of the box, working has helped us to kind of reach where before. So I would say that in a country like India, where the geography is different, the access points are different, structured approach will work to a certain extent. We need to really look at what is there on the field and respond to that accordingly. Thank you.
You are absolutely right, and completely agree with the fact that different states have a different requirement, and possibly the solution that we need to actually offer will be completely customized based on the local requirements. Before I go to Mr. Kumar Vineet, I'll go to Mr. Safirulla. Mr. Safirulla, in Kerala, you face multiple challenges, especially the emergency challenges, and one of them happens to be the pandemic, which was more than anything else. Would you like to share how did you mitigate? Because from the beginning up to even today, we have been getting maybe a very purified data or whatever is coming, but a continuous data from the state in a very authentic way, which is actually giving us a kind of knowledge in terms of how actually we are progressing in terms of advancement of COVID-19. Even in Kerala, there was use of technology also to mitigate the challenge. So if you could share your experience, the kind of challenge you faced as a digital healthcare practitioner, as an IS officer there, and some of the things that you do.
As a part of digital health, Kerala started the e-health project in the year 2015 with the Ministry of Electronics and IT, Government of India support. It was then DIT. Right now, we have expanded it to about 340 health institutions from primary health centers. We call it family health centers here, and till the medical colleges. And every day, about 1 lakh plus more consultation is done. We are in the process of expanding it and integrating with ABDM. As a part of pandemic, I would like to highlight two specific interventions which Government of Kerala had done. One is the lab development management system module, which is essentially to facilitate the capture of all the COVID-related test results. So any COVID results which are done are captured as a part of LDMS system, and the entire thing is accounted for. The second intervention which Government of Kerala Health Department had also done is the COVID death management system, which is actually an end-to-end paperless, seamless reporting mechanism, which then later on included the CDAC also. CDAC, I'm talking about the COVID Death Appeal Committee, which was mandated by Honorable Supreme Court. So the end-to-end death reporting is decentralized from the down till the Director of Health Services in a paperless way. And it has a 2 p.m. to 2 p.m. cycle, which is automatically calculated. So these are the two initiatives through digital health which Government of Kerala had done, which I'd like to highlight here, which effectively helped us to calculate all the COVID tests which was done without any interventions manually. The second, all the COVID deaths, including appeals, done in a paperless fashion, end-to-end, without any manual intervention.
Absolutely. I'll come to you again. I'll go to Mr. Kumar Vineet. Mr. Vineet, UP being one of the largest state, and you are at the center of IT implementation in the state as a special secretary and couple of corporations that you are leading in. The challenge I'm sure you would have seen that we all faced during the pandemic, but I would like to understand from you how some of the work that government did before pandemic, during pandemic, which were pushed by technology initiative, came handy. So if you could share your experience of existing IT infrastructure in Uttar Pradesh, and that actually allowed a state government to mitigate the challenge of pandemic.
Well, digital infrastructure has now become a core utility for every citizen, be it education, be it health, be it any transport, whatever you say. The digital infrastructure has to develop. It has to give the delivery of the to the citizens that the services that are actually required. So coming back to the pandemic of the COVID-19 that we actually faced, well, in Uttar Pradesh, we already had a CM helpline, Honorable Chief Minister helpline, which was existing since 2017. This CM helpline was basically a sort of a call center where we used to get into touch with the citizen, where we used to take information about the various schemes and activities that were going on in the state. So when this pandemic came, and as was mentioned by one of our earlier panelists, thus it came as a watershed to all of us. We were not prepared. We were not at all thinking about such a situation where we can be rendered so helpless in a situation. So we had to come up as a government to interfere, to intervene, and to come up with the moral support to the both to the citizen as well as to the government medical infrastructure that was actually facing the pandemic. Actually, the forefront runner, which was actually there at the medical center, where there was so much of a confusion that what actually it is and how it is going to affect. At that moment of time, technology part really intervened in a big way. So first thing was that we had a call center. We used to call after the first level of pandemic came in, and once we realized that yes, it is a pandemic, and now we really have to interact, we really have to react. So we had a CM helpline at the state level. We had a each and every district we had a call center and at a place which was in place. Now from CM helpline, we used to interact directly with the citizen. We used to make more than 550,000 calls per day. With a state of 22 crores, we used to have more than 70,000 calls, incoming calls about pandemic, be it cylinder, be it medicines, be it hospital beds, be it oxygen, be it availability of doctors, be it availability of ambulance, whatever the situation may be, we used to get calls. So once we got these data, that what type of calls are coming in, what type of situation we are actually facing in, and it was round the clock. So within 4, 5, or 6 days, we actually crystallized the situation that yes, this is the way we have to react. So we made a typical team of immediate reaction. You get a call standing in front of a hospital, oxygen cylinder is not available or bed is not available. We have a direct call line at the district magistrate level and the chief medical officer level. We can coordinate, and we got back to the citizen that yes, you are standing here. The nearest next point of hospital is that place. Your name has already been sent. You can go there. This was a 0.1% immediate reaction which was required for a citizen who actually faced the pandemic, who actually faced, what should I say, threat of life at that particular moment. So that intervention where analog concept was translated into a digital platform. Entire calling, entire the scenario was translated into IGRS, that is a successful system. So the moment a call came, it got into a grievance redressal mechanism. It went to the dashboard of each and every person officer concerned, and a solution had to come in 24 hours. Situation where the immediate intervention was required, the call center had that capability. The capability of was enhanced to the call center to call directly to the concerned officer, be it a medical officer, be it a PHC, be it a CHC or a district hospital, to intervene and get the solutions done. Be it medicine, be it home isolation, whatever the situation may be. Then, of course, we came up with certain more apps as things crystallized, like Mera COVID Kendra app to identify where can be a COVID, or test collection centers through app, through mobiles, so that we can easily identify how to get into touch with the concerned person from where we can get our tests done. Because the first phase of pandemic was really chaotic. Second phase, we were still very, very afraid, but yes, things were still there. And of course, the third phase, we are very much at ease because I just now came back from Jhansi, where I was nodal officer from the government of UP to check into how things are working over there. And I was really very pleased that situation is really at calm, at peace, and things are absolutely at ease now, because the intervention of technology has given a very big upper hand to our medical paraphernalia. They can talk to the patient, They can give a call, they can enter into a situation where they are sitting at any one place, they can interact with so many patients at ease, at their comfort, and that is the biggest thing that this technology part has done in Uttar
Absolutely.
Pradesh. And
Absolutely.
I'm the last thing that I would like to mention is that we had people who had a smartphone, we had people who had access to just a meager mobile phone, or we even had people who had access only to telephone through a PCO. So we also helped people to get vaccinated, because in Uttar Pradesh the vaccination drive has also been very good, and even through Jan Suvidha Kendra we got the management of vaccination of people done, and more than 3.5 lakh figure was just from Jan Suvidha Kendra. So in a nutshell, I would say that COVID
Right.
has been a learning experience. Our technological intervention has been very good, and hopefully we don't get any more layer of COVID as of now. But yes, IT has come to stay. IT, the intervention of IT, what we have seen in the last 2 months, maybe is more than what we could have done in the last 2 or 3 years. So that is the way which we are
Absolutely.
going to happen.
Right. I completely agree with you. I'll come back to you again. Before I come to you, Ms. Swati, I'll go to Mr. Praveen Gedam to take his view. Mr. Gedam, very recently, Prime Minister launched Ayushman Bharat Digital Mission, which falls under National Digital Health Mission. And the basic idea is to create an integrated platform where the healthcare services could be provided and could be a technological infrastructure could be provided at par with what UPI has been able to achieve for the country. I would like to understand from you, how do you look at the collaboration and synergy which is needed among different stakeholders, including both the state government, central government, and even our public-private partnership? And what is your assessment of this particular program?
You have given a very right example of UPI while describing the ABDM concept. What we do is basically we are not into the business of creating digital health solution, but integrating digital health solution and promoting digital health solutions. So it's a kind of platform of interoperability, but then there are several challenges. The UPI system deals with banking softwares, financial softwares, where the data is very structured, standardized, alphanumeric, machine readable. Here we are dealing with medical data, and medical data, a lot of it is already, it is not digitized at all. It is purely handwritten and scanned. And then whatever is digitized is digitized in different ways. There are different standards, and there are like sometimes unstandardized machine readable things. So it's much more complex scenario which we are dealing with, and therefore this platform has to have that additional capability and that additional flexibility to enable integration of such disparate hundreds of solutions from government and private sector. Thankfully, there are already standards which are accepted worldwide as far as digital health is concerned, but we are going to take a few years at least to reach to a level where all the healthcare providers start using it. So it's not going to be standardized digital data from the day one. There will be some journey which we'll have to follow. And thankfully, all the state governments, union territories, and most of the major and hundreds of smaller private players, they have shown enthusiasm. They are integrating into this interoperable platform, and we hope that this this ecosystem is stabilized and it evolves as soon as possible.
Just your thought, I would like to have maybe very quick remarks of yours around the fact that most of digital innovation that we are actually doing, be it in government and private organization, the underlining, the infrastructure hinge on cloud, and that is has become a kind of platform for innovation. So, what is your view on digitally protecting healthcare data while leveraging modern application and technology to improve patient and doctor experience?
Privacy and security of data is of paramount importance, and you would notice these as one of the principles which we have written on one of the first paragraphs about our mission. What we are saying that you use whichever storage you are comfortable with. I mean, whichever there is a TV division in ministry, there is a division about reproductive and child health, we are not thinking or insisting that everybody should use the same data center for this particular initiative. We say that you use whatever you are comfortable with. Though we encourage them to use cloud, there are some hospitals who are still using client-based systems also. So that is what is a federated architecture. So there is no unified centralized data. So that is one reason how one way how we ensure privacy and security. Then the data is exchanged between the systems only after consent of the data principal or patient. That's an additional layer of privacy. And there are so many technological privacy we say is inbuilt into the design. One
Right.
example is that the number which we generate as a health ID, or now we call it ABA number, it's a randomly generated number. There is no intelligence inbuilt into that number. So all these small little steps in policy and technology, they are basically to ensure that the privacy and security of the data is maintained.
Ms. Swati, now I'll come to you. Couple of things that our speaker have spoken so far that focus on the kind of challenge that most of the organization across the country faced during the pandemic and how actually technology helped in mitigating some of them. Mr. Gedam quite rightly has spoken about the digital healthcare platform that India is building and the kind of integrated approach it is actually bringing within our ecosystem, and also why he is actually talking about the fact that the privacy and security has to be embedded at every stage of this journey. I would like to understand from you, based on the fact that your organization works across healthcare and in different geography, and you have seen many misses and some of the best practices globally when it comes to the healthcare. I would like to understand from you, what are your overarching thoughts on India, and if you could relate it with the kind of work that the country has been able to do over the last 2.5 years during the pandemic, and some of the things that we have planned down the line. For example, National Health Digital Mission, which we feel that down the line 10 year, 15 year, it will be a completely different game altogether.
First, let me tell you that, as a company and as a citizen, personally, I'm watching the Ayushman Bharat Health Mission, and all my wishes for a very, very successful ecosystem. We all need it, right? And the war against COVID has had a pivotal impact across the world. India, in many ways, because of the scale of our population, has faced the intensity of it, but really across the world, the impact has actually transformed into how do we look at the system? Where are the gaps in the ecosystem? There are many legacy ecosystems across the world where they are wanting to bring in change and transformation. And I suspect with the success of the Ayushman Bharat Health Mission, and I'd like to put in a comment here that I don't believe it's going to take 10 to 15 years. I think it's going to be much earlier, the success of NDHM. I feel that, India stands in a position where we are poised to capture, what are the issues from across the world, create our own model, and then, share our best practices with the world. And I'm talking about the far more established first world countries and the countries who are looking towards India for more information. But I'll tell you what, healthcare in principle, wherever there are humans, there are healthcare, right? Wherever there are living beings, there is healthcare. Healthcare is universal. And if I look at it, healthcare basically is anchored on 4 key pillars, which is very relevant, across the world. One is how do we enable the clinician to bring in more accurate, effective diagnosis and also support in healthcare? How do we make it far, far more affordable? And I know India is always striving towards that, improve access and also improve outcomes. All these 4 pillars are pretty much universal across the world. And I think, somewhere I feel that, going forward, there would be perhaps healthcare bilaterals and conversations globally as to how we can bring everyone under one ambit. But all this is possible only because of digital healthcare. So the Ayushman Bharat Health Mission couldn't have come in a more opportune time. Digital is going to be the pivotal point here. smart data analysis would not only help for the near term, look at more of holistic person care versus symptomatic care, and also address, long-term, diseases and new diseases, cancer, diabetes, and so many other things, cardiac. Data analysis is a very critical aspect of the healthcare ecosystem, which I know would get addressed very effectively under the ABHM. Automation of all the manual processes, the administrative, grunges to reduce costs so that ultimately there is enough to reinvest into the ecosystem and the citizen does not face much impact. In addition, of course, high quality diagnosis being the critical aspect. I do believe that one of the things that we all as a community in India and of course across the world, but definitely in India, should look at is not only create robust standards within healthcare, but also ensure that these standards are interoperable and speak to other standards like HIPAA, or for that matter, the cyber security data standards like high trust, which are standards that will ensure that this highly sensitive and deeply personal data is also managed and operated very carefully. So that's one submission, that whatever we do it from the lens of standards. I know we'll do it from the lens of standards. I've loved the architecture that the ABHM has really put forward. So that's one thing that I'd like to share. And also, in addition, I do believe that, given the scale of healthcare data that we are going to create in India, we definitely would become, and COVID has demonstrated it, we actually can become a global leader in healthcare and also have ambitions of becoming a global health hub. And why I'm saying that's important is with not only with our citizens, but citizens across the world, right? We can, make this into a data analytics center, create health tourism with the right insurance, reforms, digital health services, and I must also add telemedicine. If I may just give me a minute more. I do believe telemedicine is something that we can look at as an extension of our ITS services. Also, why I'm saying that is with just small reforms in health regime in the license regime, we can open up telemedicine for across the world. So that's a few things that I thought would be good to highlight.
Now I'll go to Dr. Akash Malik. Dr. Malik, you heard our speaker talking about some of the challenges that we faced during pandemic and as to how they use technology to mitigate them. And Ms. Swati very eloquently mentioned about the fact that we need to go global, focus global standard, and do work in and around and the kind of data that we'll be getting. So the data analytics part becomes very important, the kind of processing that we use in. Based on your assessment of yours, especially with UNDP and the work that you are doing with the government organization, what has been your general assessment in terms of our trend towards using technology and the challenges that we face in healthcare? Are we on right track, and do we need to change the gear?
I think my seniors and my friends before me have already made a very strong point that yes, the COVID pandemic has paved a way for using digital technology to make the healthcare system more accessible and more more transparent in terms of the services, so that the services are recorded in terms of the beneficiaries who are due to receive those services. So if I take the example of the CoWIN platform, which is currently one of the largest vaccination platforms in the whole world and has the data of more than 1 billion people who are registered in the country. So the CoWIN platform is an excellent example that it uses the global technology and open source technology and has paved a way that in a short period of time, India can come up with systems that help us to capture the services which the healthcare system is supposed to deliver. And the another beauty of what we have been able to achieve in the COVID pandemic is that we have been talking about, as Praveen sir has been talking about ABA, and Vineet sir has been talking about, how the UP is doing digital innovations. So all this has been integrated in or can be integrated in CoWIN very easily through APIs. So every beneficiary now has an option to create his or her ABA ID by simply logging into the CoWIN platform. So this interoperability and integration is very important, so that we have a one kind of a window system for a beneficiary, especially after the beneficiary has an ABA ID. Then he or she should be able to use the ABA ID to access any services, and we should have a common digital database for the national digital health mission. And as Swati ji mentioned, it should happen very soon, and it is happening very soon. I can tell you that being part of the CoWIN team and working very close with the government, I assure and I reiterate what Swati ji said, that it is happening very soon. Very soon we'll have a single window system where the beneficiaries can just access all the services which they are eligible for under the National Digital Health Mission.
Yes, please. Yes, please go ahead.
Just quickly, I think what is very, very important is that we, while the digital health record, electronic health record is very, very important, I think what is very, very important is that digital health should become enabler at every level. From the healthcare provider, we have thousands of healthcare workers on the field on whom the whole primary healthcare system rests. And then you have the facility-based care. And in the COVID pandemic, in the first phase, 90% of the work was done at the primary healthcare level, and about 10 to 15% at the in the facility. That was the first referral, and mostly the tertiary. Even in the second wave, it was about 30% hospitalization, so 30% of the load. Even 20% we were flooded, 80% of the primary healthcare. What is very, very important is we understand and enable the healthcare workers to use technology. Now, for example, in Telangana, the A&M registers, which are 35 in number, where they have to keep on writing for 3 to 4 hours because they will not be able to carry these registers. And this happens across the country. Now, in Telangana, the A&M registers are all online. So when you go to the field, the worker says, 3 hours of my time is saved, and I'm able to concentrate on the quality of my work. And I think that it cannot be said that the digital health record is much more important than making healthcare workers work much easier than what it is today. 3 hours of work and carrying those registers for me is, making her tech savvy, and she has this tablet which she carries around in Telangana, where all the health records, whether it is maternal health, whether it is child health, whether it is NCD, whether it is CD, whether it is the fever survey, whether it is a COVID vaccination, all of it, the data is carried to the tab. So I think it is about empowering healthcare workers, and a medical officer, if he has his system, a tab or a smartphone where he's able to actually access different types of information. So I think that's very, very important. As important as, say, the teleconsultations which we do, or as important as the EICU, which we started, where the NIMS hub super specialist is able to connect to a remote hospital. There are cameras there, and they're able to actually read and guide the specialists if they are available. In our remote areas, we only have medical officers, and guide the medical officers. So in a small town like Sirsila, which was sending off patients, anything below 80, they were sending the patients off to Hyderabad for care. Today, Sirsila, after the EICU, where you have super specialists doing virtual rounds, Sirsila handles even below 60 because they have the confidence that super specialists. So I think the conversation on digital health has to be much more layered and much more. And, we are actually, if you talk to us in the field, we are exploding at every level. In the sense that if I, as a administrator, I say, I want this, you have the technology experts come in and make this happen for me. For example, we have the diagnostic hub in Hyderabad and 20 other districts where blood samples are collected from the sub-centers and they're brought to a central hub. And within 24 hours, it's a bidirectional software where barcoding is done. And today, within 24 hours, a patient receives a blood test, a complete blood pressure, 57 types of tests on his cell phone. And as an administrator, I'm also able to see how many blood tests or diagnostic. Same thing with X-rays. We have online X-rays going. We have ECGs being taken in districts, and it goes to experts sitting in Bangalore. They are able to read and advise the patients in the doctors in the hospitals to be able to whether he can be stabilized there or whether intervention is required, what kind of it is. So I'm just saying it is so, and the potential is so huge. So I just thought I should just say this.
Yes,
So
yes,
we
absolutely.
don't look at it in a linear way. I think it has to be much more layered than this.
Mr. Naveen Kumar, I think Karuna ma'am raised a very important question that technology platforms ultimately has to be enabler. It has to actually help people, the ecosystem within healthcare system to do things in more efficient and agile way. Uh, and that brings to a very important element that which is the kind of value that digital could bring to anything that we do. So one thing is fact that integrated online platform, it has played an immense role during the pandemic. So for example, the smart cities command and control center, whatever the cities were able to set up, I mean those centers were used by not only the municipal administration department but also the allied department to deliver the emergency services. So I'd like to understand from you, how do you look at the technology based platform and what kind of value digital brings for different stakeholder in healthcare delivery, given the fact that now you are at the front end of a digital healthcare?
See, one of the things which we did in Andhra Pradesh is we have an extensive grassroots network called volunteers. And also we have a network called Grama Vada Sachivalayam. For every 2000 population, we have one ANM. I think this is something which no other state has. Okay, so that is, and what we did is we have given them an app called Fever Survey. Right now we are doing the 39th round of Fever Survey. So these volunteers along with the ANM go house to house fever survey data. And what we solved is, if you see what we call this pandemic is the choking of the healthcare network, right? So what we did is we proactively went house to house, found out if there is a person who is symptomatic, get that person tested. If he's turning to be positive, you take them, you triage him whether he needs an CCG, triple C or additional care or tertiary care. We triage and tell them. And then what we also did is that person, if it need be, we also keep him under home isolation with kids. We also started giving out a home isolation kit. So if you see Andhra Pradesh during this wave 2 also, we could do the surveys along with the call center, where a full technical team was sitting with doctors, and they were also following. If I get a call for a medical expert, the alternate day, automatically the call would go from the call center to the person to see if he's okay, if he needs a bed. If he needs a bed, again, they will find if there is a bed available nearby and get him to the bed. So that is how the entire, I think probably Andhra Pradesh is the only state, or maybe Telangana ma'am is also there. So Telangana would be other state where we did not go for a full lockdown. If you see it, we did not go for a full lockdown in this wave 2. And in the wave 3, if you've seen it in the January, we were prepared for it. And I think it has subsided. And we have been doing this survey. We also, when you do the survey, we also know that, okay, this is the kind of load which will come. We'll also prepare for it. That's one of the success which used platform. So you can imagine the grassroots worker as having a app, and then the data comes to command control. And like Vineet had mentioned, the n number of things have been coordinated, oxygen coming in, beds coming in, availability of bed, because this is exactly, see, the chaos comes in when people do not have access to information, right? So that's exactly what we did using technology. Part two, like ma'am said, one of the things which we would also look at in the future is when you're doing all these diagnostic studies and putting out data, it'll also tell you. I'll put it an example for you. We studied cancer registry in Adayar Cancer Institute. So what they do is they also find out what is the emerging genomic cancers which would come in the future, right? So For example, I'm right now posted in Punjab for the election, so I would also know that Batinda is known for large number of cancer cases because there is a pesticide coming up. So these kind of data would also come in the platform. And what happens for the scientific community, to prepare themselves, and this knowledge is very, very important. So I think this is something which we would see as a future of ABDM. It's not just what we do, putting our diagnostic reports. It will also tell us what is the kind of cancer, which I'm just putting a cancer example because we have been working on it for some time, so I could relate with it better. So that's the kind of information which should come, and then we'll also prepare strategies for it, right? So that it's not just, I would use this word data mining. So this would be the future of what you call the digital healthcare, where you prepare yourself. And technology is not just like it is one is that is going to ease the ease of doing business for the field workers, which ma'am had mentioned, Karuna ma'am has mentioned. At the same time, it also prepares the infrastructure. So I completely agree with Karuna ma'am calling it an enabler, and I think Vineet also was talking about it in the in his opening remarks. When you see it, this is the kind of, I think that's what I was trying to tell you when we started giving this mobile apps and all these equipments to the people, they were not prepared to do it. And when they started seeing it, now that the technology is trustable, that's the word I would put it, because I have been seeing IT projects for a long time, and now you can see that there's a lot of support for technology to being put to the grassroots, and they see okay, this is going to help us. And COVID has helped us to realize technology is one of those, I could put it like one of the best friends we could have for government in the recent past.
Absolutely. I'll go to Mr. Safirulla, and thereafter I'll go to Mr. Kumar Vineet. Mr. Safirulla, very important thing, Mr. Naveen Kumar mentioned that technology has become an enabler, and it is enabler for the large ecosystem. At the same time, it offers you the kind of visibility that you need in future. So for example, you have large sum of data, and if you are able to actually create some form of analysis out of that, and if you and possibly accordingly you can create your policy, you can create any remedy measure needed in the future. uh, what has been your assessment of use of technology in Kerala vis-a-vis the digital value that we look into it? If you could share your thought, especially around the integrated platform that we are discussing about.
In Kerala, we have been able to put technology and the data to a reasonable use, in my view. For example, in the COVID, the debt management system that I was talking about, we were able to draw many policy measures from the analytics that we did. For example, we took the debt data and we did a machine learning, to be specific, unstructured machine learning. We did correlation, K-means algorithm, clustering. So through this, we found out what are the two comorbidities which has resulted in maximum deaths. And we found out that in the with age, the comorbidities combination of diabetes and hypertension lead to maximum death. And therefore, what we were able to take a decision is, once a patient who is having both hypertension and diabetes, irrespective of the age, once he or she becomes positive, they should be admitted in the hospital, and home care is not allowed, because that is one where maximum deaths are occurring. This is one specific, I'm just giving an example. The second example I like to take is, we did a lot of analytics on the aging, that is the time taken for a patient to become positive, and the number of days the patient is getting taken for him or her to get admitted in the hospital, and the incident of death. Therefore, we were able to do a lot of clustering and analysis, and we found out where the maximum delay is occurring. There, we were able to make targeted interventions. This is just in the case of COVID, a couple of examples that I gave. But I'm also happy to share that we are working with about 9 startups on 9 unique solutions. 3 solutions are already there. One solution is diabetes retinopathy, on how do we use AI for identifying, once you take a sample, on what is the incidence. So that is a solution which we have started. We also have started the blood bag traceability using blockchain enablement, and we are working with startups on other initiatives also. So the point that I'm coming to is, a lot of these solutions have been put to use, but at the end of the day, in my view, the health informatics is more about change management and less about technology. If we look it as a technology project, we may not succeed. But however, if we are able to look it from the perspective of change management, for example, how a citizen, instead of going to a doctor to take an OP consultation, is ready to fix an appointment online. It's a huge psychological point. This is a huge barrier from the citizen's perspective. Similarly, from a health practitioner's perspective, whether he or she is comfortable making the diagnosis entry in a condition like medical college, where a doctor looks at about 100 patients a day. So it is again a change management problem, and from government side also. So I feel that the more we have worked on it, I find my personal observation is that the more we give importance to change management, the more success we have been able to attain. Thank you.
Before I come to you, Mr. Kumar Vineet, and I'll just take one more question, answer from Ms. Karuna Vakati. Ma'am, if you could share your views, basically what we are actually understanding that tech has become an enabler for an entire digital ecosystem. But within tech, we are also collecting large sets of data, and that brings us to an important element, which is as to how we are processing data, how actually we are analyzing it, and how we are treating data in itself. So the people trust on technology, people trust on the system that we have put in, will be a bit high if we are following the global level of data protection and security. So given the fact that some of the speaker mentioned that now the time has come to move toward exploring the next generation technologies such as AI and machine learning, based on that, given the existing architecture that we have, what is your thoughts on having a policy framework wherein the cybersecurity and security could become an integral part of our healthcare ecosystem?
I think that's a very important topic, in the sense that that is where the real challenge lies. One aspect is, of course, the whole, the secrecy and privacy issues. But I think where we are losing out majorly is, on the data analytics. See, I have, like, for example, the non-communicable diseases. Telangana, as per the WHO report, we have all the data online. We are treating 73% of the patients even during the pandemic. But beyond that, I have no insights into what the disease is doing, what is the impact of our treatment, etc., etc. And you look at any database that we have, like the diagnostics database, like the pregnant women, we now have the whole data real-time tracking we do of every woman who registers in our system, which is more than 80%, more than 90% of the women register with us for the ANC checkups. But I'm beyond that, I'm sitting on huge databases which can actually give us a very, very beautiful and unique insights into the way forward. And India is on the verge of achieving SDG goals, on every aspect of health, and especially the southern states. We are already there. So we are actually ready to go to the next level. I think next level, where this data insights are going to be very, very useful, and we are actually hitting a block there. We do not know where to turn to. And I think that is the real important thing. That is one very, very important aspect of the whole digital technology, that it gives us an insight about what's happening.
Absolutely. Now I'll go to Mr. Kumar Vineet. Mr. Vineet, if you could, given the fact that your co-panelist has spoken about, now we are at the stage wherein we are trying to explore next generation technologies such as artificial intelligence, machine learning, blockchain, in order to create within the government ecosystem an IT infrastructure which is able to provide an enabling platform in times of pandemic-like situation. Would you like to share your thought process, especially around exploring technology like AI and machine learning and all, and the kind of work that the state of Uttar Pradesh would have done in this particular area?
In India, the ratio of doctor to number of per thousand population is less than 1. It is 1 against 1,445, which is much below the World Health Organization norm. So technology is here to stay. Even we are much behind what is there in what the situation is there in our neighbors, even our close neighbors. And this, when I say it is 1 to 1,145, we have states like Tamil Nadu also, who have 4 doctors per 1,000, which is much higher even the European standards, even much better than UK and US and at par with the Norwegian states. So that is a scenario in which we are actually talking about digital health mission. And that is what actually we have to understand. Mr. Naveen was very right in saying that now we have a dependable technology. The technology we have to depend upon, number one, and the technology we have to faith on. So technology that has been in vogue, which has been there, what we have used, has given its best. Now we are transcending into a situation, as Swati had also said, that it will not take 5 to 10 to 15 years. It will be hardly a matter of say 5 to 6 or 7 years max, where we are going to have a beautiful system, beautiful ecosystem of this digital health mission. The mission mode of digital health is definitely going to be there, and that is going to stay. That is going to stay for long. When we went to London, I also went to London. I just had a small NHS card. And what I had to do was just to give a call or just put up a mail or just give a call at the center and tell my physician that had I been assigned to that this is a problem that I'm having, and the physician used to take care of everything. At his place, there was my entire data, my tests, everything was absolutely in place. So this is exactly what we are trying to perceive. That is the level of ease and translation that we are actually aiming at. When we talk about this ease, that what we are aiming at the back end, we need huge technological intervention. One is my data has to be safe. One is my accessibility has to be very clear. Third is my privacy has to be very sharp. And finally, it has to be easily accessible both in the private as well as in public domain. So if I go to a private doctor, my data should be easily accessible to him or her, or if I go to a district hospital, even there my data should be accessible. So we need a common platform where accessibility of doctor as well as patient and their synergism is the need of the hour. So that is the aim that actually we are talking about. When we talk about this level of intervention, I would say blockchain technology is something that we have to look into. Artificial intelligence is something where we have to look into, because a majority of patient needs someone to listen to, and just by listening and just by giving the basic medicines, things get better. So artificial intelligence about the doctor, about the scenario, about the region, or as mentioned earlier in particular case that cancer patients and things like that. So that is going to come up. And secondly, this blockchain technology, which can just pick into my data at different places and commit to in a beautiful way, and my privacy is secure, much more secure when we use blockchain technology. And of course, that is going to come up. Things which we are using, the Windows and everything, are going to be what should I say? Vestigial things in IT technology. So yes, of course, technological intervention has to be there. And one very important thing that I would like to mention, one more thing, is that is chatbot. So chatbots should be there for every physical practitioner, for every hospital, for every person over there. And behind the chatbot, there can be a battery of medical experts that can just check it out and just ease it out, and a battery of medical experts can just diverge it into not just 1:1,000, but even more than that. So that is the technological intervention, and that is the environment that I'm looking forward to. And given the pace, Honorable Prime Minister has already defined the pace and has already set the momentum. So I would perceive that new technologies are going to come and they are going to stay. Along with it, just one more thing to add, we also need hardware part also to come over here. Things should settle in an ecological balance in the same paraphernalia in which we are living in, be it North Zone, be it South Zone. The data center should come up. We have a data center policy, because that is why I'm just mentioning it. We have got a beautiful data center policy also. So our data security has to be very important. Our privacy has to be very important. And an ecology in particular area where medical, health, and different aspects related to it should come up. So that is what I would like to have in India, and that is what we are aiming at in Uttar Pradesh. Thank you.
Right, absolutely. Ms. Swati, now I'll come to you. I think Mr. Kumar, Vineet mentioned a couple of things which is highly related. One is the fact that the technology-led platform is the reality, and solutions based on AI and blockchain is going to actually help us in terms of processing the data, in terms of creating more visibility within the healthcare ecosystem. So even if you have a chatbot and there are a practitioner in the back end, he would need data on the go just to understand the case, report the case, and give his best advice. Since your organization across different geography process huge amount of healthcare data, so there are two things that I would like to understand from you, that your thoughts on number one, data protection. We already have a data protection policy in Parliament, right? And second, that uh, digital healthcare, within digital healthcare, what are your thoughts on strengthening digital healthcare through public private partnership? Because what really happens in any ecosystem, nobody is alone can provide all the solutions and services. It's a world of competition rather than competition.
Yeah, so thanks. A very pertinent question. When we talk about data protection, so Vineet Kumarji mentioned the importance of robust standards and how India has already scaled up quite a bit on that. And earlier I mentioned about the importance of, while we are creating standards, it's important that standards talk to each other universally, because healthcare is a universal issue. Vineet Kumarji also very rightly mentioned that while convenience is and easy access is important, data security or the way data is managed is paramount. And that's where I think the data policy comes into play. I'm very glad that India is thinking in those in those terms, and just to actually bring in a little clarity that the data protection policy is not yet out. It is just the recommendations that are there in the parliament. You gave me a little bit of a shock. But coming to the data protection policy, the issue with the data protection policy, I think the intent is brilliant. A lot of it is alluding towards the right direction. I do feel as an industry, we are data processors, right? In India, we are managing massive amount of data of foreign citizens from different countries. And how actually it works is that we collect foreign, citizen data in foreign land, and Indians, because we are a hub and we are so brilliant with IT services, we actually help process it directly in the servers. If you look at healthcare and healthcare data in principle, it's very, very personal to the citizen, to the data principle. It's my healthcare information. And I want to know that, I can, trust you, Mr. Company, with my data, and you'll ensure robust standards around it. Companies like mine follow HIPAA and, like I mentioned, high trust earlier. These are standards that are very complex and strong when it comes to data security and also when it comes to healthcare data. But a part of this also is, I'm talking about the data protection policy, is it's important that while we recognize that, citizen data is very important and needs to be handled carefully, the same way citizen data of other countries are also needs to be handled with the same fervor. So data protection of citizens from other countries, their data protection policies should actually come into play, if you know what I mean. The data protection policies need to talk to each other, and the jurisdiction of their countries should hold precedence over our jurisdiction. Why am I saying this? Ultimately, I do envision India as a healthcare hub and a digital healthcare hub. And if that is the case, then of course, India would also envision engagements where we become like a hub or a supplier to the world. And in that context, you've got to appreciate and value the laws of other countries. So exemption from this data protection policy for data processor companies who are managing healthcare of foreign citizens, and I'm being careful in saying foreign citizens, right? I think would be a good idea. It would help give us a very good opportunity as a country and also help expand the larger vision of healthcare. So I hope that addresses
Yes,
what you're saying. And I'm
absolutely.
positive. I would like to just add that I'm very positive. The good thing is that the Indian government is very active today in engaging with the industry, and in it's almost like a partnership. So I'm very positive that with ideation and discussion, we
Right.
will, as India, have a very powerful data protection policy that will support
Right,
all of
right,
us.
right. I'll take a view of Dr. Akash. Dr. Akash, Ms. Swati mentioned very important thing, which is around the operability. And you have a different geography and different laws and regulation to deal with the data. What is really needed that your data protection law should talk to the different data protection law, and you need to have an ecosystem wherein those both of them could talk to each other and a policy decision, and based on that you can create whatever you want to do it. Based on your experience, in terms of the policy framework that we have in our healthcare ecosystem, uh, what is your general assessment? Are we doing things right, or do we need to actually, from a policy perspective, especially in relation to the data protection and the healthcare, that we need to possibly be a bit more flexible?
So I think I will completely agree to what the points have been made earlier. I think even though there is a recommendation for the data privacy policy, but as Vineet sir said, so there are state level initiatives. Also, what I like to reiterate is that every application which is coming up, whether it's Arogya Setu or whether it's the Abha or whether it's Covin, every it is the government ensures and that the privacy policy of the application is well defined and is within the scope of that application. And if there is any sensitive data, then a proper consent, a detailed consent is mechanism is there within the softwares, so that whenever the beneficiary enters that data, then he knows that what the data will be used for by the government. Also, further to that, I like to add is that as UNDP, has been working with the government for long on various digital health initiatives, and have recently come up, at the global level, uh, come up with a digital policy for next 3 years from 2022 to 25, and precisely the policy makes the points which the esteemed panelists have made. That is, that with the data and the digital technologies, data has now become a human rights kind of an issue. So it's more of a human right, and how that data should be used, so that the person's privacy is maintained.
Right.
Secondly, it should be inclusive and should be gender sensitive, and at the same time should not leave anyone behind. And about the question you asked, it should be the technologies and the data systems should be open and should be adaptable to local standards and frameworks. So irrespective of what government of India at the national level is coming up with, it should be easily integrated and adaptable into the systems for what UP is doing, or what for Telangana is doing, or what Andhra is doing. And that is what the new technologies are talking about. So if you see the API Setu initiative of government of India, all the softwares can talk into each other using APIs. The softwares are becoming more and more modular rather than more rigid structure that used to be earlier, so that it makes softwares easy to talk to each other. And as I mentioned earlier, and as Karuna ma'am also mentioned, having a one window system and one database system will make it very easy for our healthcare workers also, because they will also have a single platform to record all these services. Because in India we have an inverted, kind of a pyramid system, where at the national level, at the state level, we have various verticals for various health programs. We have a vertical for reproductive
Right.
health, for maternal health, for child health. But at the end of the point, it comes down to the healthcare worker, who is the ANM and the ASHA, who has to use all the softwares if which the individual verticals are developing. So it's very important that akin to the structure, the software are also developed so that the healthcare workers have a single point system for recording all the services, and that reduces their workload and increases the efficiency and effectiveness of
Right.
the interventions and the services.
Right, right. Last word to you, Ms. Swati, especially around what Dr. Akash said, to have an open and resilient and interoperable architecture should be the foundation for whatever we are creating within government and most of the system, because the best thing that is happening in Telangana and Hyderabad could be imbibed and implemented, let's say, in Odisha and Bihar. So your last word on that.
Yeah, I mean, if you look at our states, I mean, we are like mini countries within a country, right? And when we're talking about interoperabilities and interoperability of the data protection system, and when it covers nationally, it should also recognize, therefore, I mean, like we're talking about recognizing state efforts. In the same way, it should recognize, data protection policies of other countries. Because every country today is coming up with this. This is the perhaps most important policy that a country can come up with today. I would actually like to add to say that, the Joint Parliamentary Committee has been very sensitive towards foreign citizen data and has actually highlighted that, we should exempt foreign data which is of a foreign company that is just processed in India, so to say, or processed by Indians. They're ready for an exemption, but it is an exemption on approval. One way of just ensuring better ease of business is to perhaps say that, if the foreign data is handled by very robust security and health standards, then let us automate it, because those standards itself are so deep and complex. So all the intent that the data protection bill wants to basically achieve, that is ensure secure and comfortable data processing for the citizen, keeping the citizen in mind, right? So that can be achieved when we get automatic exemption basis the standards of healthcare, like the HIPAA standards or the HITRA standards, right? So I do believe the data protection bill will, transform, will become far more robust. And the only point is that they should recognize the jurisdiction from where the citizen comes from. That's all.
Absolutely. I think you all spoke quite well on the kind of challenges that most of the organization faced during pandemic, and as to how technology came quite handy in mitigating them. Some of the challenges and some of the work that we need to do, especially in and around having an integrated technology platform, which is able to mitigate the emergency responses in future, and especially Ms. Swati views around having an integrated platform, but also a platform wherein the data of one country or one geography should be speaking to the data policy and data of other country. And there should be some exemption on the policy level that we are actually envisaging. So thank you so much for being such a wonderful panelist. Thank you so much.
Thank you very much, panelists, for your participation and all the valuable insights shared by all of you. Thank you very much. Well, ladies and gentlemen, now we'll take a short break once again. Stay tuned, everyone.